Well, thanks for joining today. This is our an exam one review. This is the second of three. Professor Ford did one Monday night. I'm doing one today, and then Professor Kershaw, I believe, is doing one tomorrow. So, do you ladies have your study guides?
Right now, I'm a little bit. Is this it? It's okay if you start. I have like plenty of them.
Well, do you have the one that I sent you the other day for this particular exam, or
Hmm.
that your professor sent you? Candy, you're not in my class.
I have one. You can wait a
I
minute.
can get
I
going. Oh, okay,
Yeah, you can. I was supposed to be ready, but I
that's
thought
okay.
we were gonna get a few minutes, but it's just my fault.
Oh,
It,
no, it's noon, so I wanted to get started because I have to give an exam in about 50 minutes.
okay.
Okay. Yes,
Okay?
ma'am, you can get started. This is Brandy.
Yep. Hi, Tyan.
Mhm.
Okay. I'm gonna get going. Brandy and Tyan. Hi, Tyan.
Hi, Professor.
Hey, how are you? Hi, Brandy.
Good.
Hello, Professor.
Hi. All right, I'm gonna share my screen because I want to pull up the study guide. Can everybody see that?
Yes, ma'am.
All righty. All right. Thanks you guys for making the time to come today. I really appreciate it. So a couple things. One is this study guide, just to start off, was made, or it's a compilation of a few things. It's a summary of the first 3 weeks. Okay. It includes lecture material, weekly notes that are sent, and your readings and discussion questions. Okay. So all four of those resources, readings, notes, lecture recordings, and homework assignments are all put together, and we've created a guide for you, okay, to study. My suggestion would be that if you've attended the first 3 weeks of class or the recordings, please take a look at the study guide first. Okay. If there are areas on this study guide that you don't understand, or you need to get more information to better understand the topic or concept, then go back to your readings for that particular topic. Go back to the week of lecture it was covered, and then go back to your weekly notes of the week that that topic was covered. Okay. At this point, I suggest that you reread all the reading week 1, 2, and 3. Okay. The study guide is a summary. Go back to all those other resources I just talked about if you're not understanding on this something on the study guide. Does that make sense? Okay.
Yes.
So I have outlined for you reading, I have copy and pasted from the syllabus, so you don't have to go back and look. Here's all the readings that were assigned weeks 1, 2, and 3. Okay, so they're all right there for you. Okay. Exam, 50 questions, multiple choice, select all that apply, math problems. Okay, and I will tell you there's several priority questions. What does that mean? Give me an example of a priority question.
Something that needs to be done first in
Mhm.
an emergency situation.
Okay. What are some other key words that would jump out to be a priority question? What is
would be
the first, last, greatest, least, priority,
Or most important.
most important? Okay. What would a negatively asked question? Give me an example of a negatively asked question, because there are some on the exam as well. How do you recognize a negatively asked question? What would that mean?
Do you mean like something that does not relate to the problem at hand or the answer?
Kind of. What I mean is, let's say you're doing discharge teaching of a patient that's had a stroke. Of the following answers, which of them tells you that the patient does not understand the teaching? So you're looking for them to say something wrong. Or let's say you've just finished teaching with a family whose kids are at risk for obesity.
Okay.
What does the mother say that makes you believe that she didn't understand what you just taught her? Maybe the answer is, oh yeah, my kids are going to have 100% fruit juice with every meal. Is that wrong?
Yes. Okay. Yes, it is.
Right. Do you understand that? That's a negatively asked question. So you're
Yes.
looking for the wrong answer.
Okay.
Make sense? That's really
Yes.
important. Okay. It's what shouldn't be happening. So if you read a question and there are several right answers, or you think there are several right answers from reading the question the first time, and it's not a select all that apply, what should you do? Go back and reread the question in case you missed an important word, phrase, or cue, like one of those priority words, or it was asked negatively. Okay. So if you find there's more than one answer that could be correct, go back and reread the question. Remember, and select all that apply, all can apply. Don't be afraid to choose all of them. Okay. At the end of this study guide, you were given math. No, you weren't given math. Nope, not here. I sent you a resource from Dr. Bogart, from Professor Bogart, on easy math formula. Easy math formulas. Okay. Did everybody see that? Brandy, Tyan, did you guys see that?
Yes.
Yes, ma'am.
Okay. So if you have trouble with math, please go back and look at that training session on her YouTube channel. And the reason why I didn't send you several other math resources is I didn't want to confuse you. This particular training from Professor Bogart shows you from basic math how to start to solve a problem. It goes through calculations, it goes through conversions. It's super easy, and it's super easy to understand. Okay. All right, so let's go through the study guide. I'm not going to go through all, I know it's long, but remember, it's 3 weeks of material. And like I said, start with the study guide. If you have an understanding of the study guide and can apply it to clinical judgment, right? A situation with a client, you will be absolutely fine on the exam. And I mean that. You have to be able to articulate the study guide. One of the first things you need to understand is the difference between community-oriented and community-based nursing. You will be asked about this. You're going to be given a scenario and asked, is this community-oriented or based? Remember, community-oriented, you're looking at the whole population. It's primarily focused on health promotion rather than illness. Okay? You're looking at the whole group of people. Community-based nursing is illness care. Okay? Illness of individuals. So just think, if you're oriented, if you're trying to orient yourself to the community, you're trying to look at the whole population. If you're based in the community, then you're taking care of individuals in the community. I don't really know any other basic way to explain the difference. Does that make sense?
Yes.
Okay. We need to know primary, secondary, tertiary. Okay. Primary is prevention, secondary is screening, tertiary is treatment. Right? So with prevention, we're trying to prevent something before it happens. Maybe an illness or an injury, maybe helmet safety, seatbelt safety, immunizations before it happens. Secondary, early identification, early intervention, early detection, preventing complications, attempt to reverse course. Okay, so that would be blood pressure screenings, mammograms, pap smears, pesticide risk. Okay, so you're screening for risk, trying to identify something early and treat it early. And then tertiary, you have to have something. You have to have a disease, a condition, an illness, because tertiary is treatment. You're managing what you have, or you're trying to help the client manage the disease, manage the symptoms, and try and improve their quality of life. Okay, maybe low sodium diet for hypertension, checking blood glucose for diabetics, weight loss with somebody that has obesity. They have to have something. Okay, vulnerable populations. You need to know your vulnerable populations. Poor, homeless, pregnant teens, veterans. Don't forget about veterans, migrant workers, immigrants, severely mentally ill. It's all right. I'm right here. It's all right here. Okay. Social determinants of health? Safe housing, transportation, neighborhoods, racism, discrimination, violence, education, and on. Remember this is really important. Poverty is a primary cause of vulnerability. Okay, remember that. And just because I'm highlighting certain areas doesn't mean that's all you need to know. I'm just going through this study guide to show you how to use it. Okay. What do we know about disabilities? Complex physical or mental disabilities increase vulnerability. That's obvious, right? Outcomes of vulnerability. Without intervention, what's going to happen? You don't even need to read this. You should already know the answer to that. Without interventions, they're going to be sicker, probably increased morbidity and mortality, maybe an increased chance of chronic illness, right? What are some interventions for the vulnerable population? Well, first and foremost is therapeutic communication. Okay, you have to establish you have to use and establish therapeutic communication before these populations of vulnerable people are going to trust you. Right? Remember, very vulnerable populations are going to be less likely to open up to you, tell you their story. But if you establish trust early on, use therapeutic communication, respect each individual, know that they're worthy, know that making no assumptions, let them tell their story, right? I mean, you don't want to ask them, how long have you been abusing drugs? Why do you let your husband abuse you? Why don't you work? None of those questions. Let them tell you their story and go from there. Okay. Resiliency. You need to understand the word. What does the word resiliency play or mean? What does that mean?
Overcoming or
Pardon me?
bouncing back. Overcoming or
Exactly.
bouncing back from a bad situation.
Yeah. Having coping skills, overcoming things, fighting against challenges. Okay, the more out of control people feel, the worse their decision making becomes. That's obvious, right? Lack of resiliency generally leads to individuals making decisions that worsen their circumstances, right? The more resilience people have and the more we can help people develop resilience, the better chances they have of decreasing their risk, right? Don't forget about caring for the caregivers, okay? We always forget about the caregivers, all right? The caregivers are the chronically ill, right? Caregivers, we know, are at risk for mental health related to burnout, stress. They're also at risk of neglect and abuse of the family members, right? So we want to make sure that we are looking after the caregivers. Maybe a primary prevention would be educating the caregiver on stress and burnout, right? Educating them before something happens, teaching them stress reduction techniques, encouraging support group with other caregivers, right?
Yeah.
So when we're working with the homeless, it's important to create a trusting environment. We just talked about that.
A respite care.
What?
Is it respite? What's it called?
Yes.
Respite.
Yes. So read this paragraph about trusting, creating a trusting environment. And then this next bullet is about homelessness, how it's correlated with poor health outcomes, right? The incidence of chronic and acute illness, say AIDS, physical trauma, is high. Okay, where do homeless people seek out their health care? Emergency rooms, right? Healthcare crises usually are sought in emergency departments, right? Which makes it what? What's the problem with that? It makes it very expensive, right? Vulnerability can be reversed by obtaining resources to increase resilience. Here's some examples. Learning basic language of the country of residence will give immigrants the ability to communicate and navigate through the system, right? Okay, so next topic is school nurses. We know about school nurses, they triage many complaints, right? We need to always prioritize our ABCs, okay? So if you're given a question that says, which child should we see first? And they have a list of, different kids, one missed their medication, one fell and skinned their knee, one's having trouble breathing. And the question might be, which child should we prioritize seeing first?
Airway.
Right.
The one
Remember
having
that,
breathing issues.
yeah, exactly. Think of your ABCs. Remember that kids don't just come to the clinic for headaches. This is the next one. Headaches and stomach aches. They do, most of them do, but a lot of them don't. It's important to be able to evaluate if there's anything else going on. If they've been coming to the clinic for 2 weeks every day at the same time at 10 o'clock in the morning and say I have a headache, eventually you're going to figure out that they don't have a headache every day at 10 o'clock, right? Maybe you call the parent, find out if there's anything going home, maybe at home, maybe talk to the teacher. Is there anything happening in class? Because right after your class, they're coming to the clinic. And the reason we mention this is because, yes, it is common for students to come with headaches and stomach aches, but not chronically. So then we have to look at other things like maybe bullying. Are they struggling in a particular class? Is there any kind of physical, sexual abuse going on at home, emotional abuse? Right? Is there marital issues at home? Is their home life unstable? So my point is you have to be able to think outside the box. Sure, if they come in for a headache or stomach ache and you give them whatever and they go back to class and you don't see them again. But if they're coming in day after day after day, you have to start to think there might be other things going on. Okay. So same thing here. Maybe they're escaping bullying. Maybe they're being bullied in the class, in their next class, and they don't want to go. Okay. This next bullet is about the rates of obesity in children that have been rising steadily and for a variety of reasons. And this paragraph explains why. Okay, so that's obesity. We know that unemployment and depression in the family have produced problems for the kids, right? We know that unemployment and depression going on with the parents, right, may result in adjustment issues for the kids, maybe impairments of social and academic functioning in the school, right? I mean, kids bring their home life to school, don't they?
Yes.
Yeah, they do. School nurses' initial interactions with families should support the goal of establishing a productive and culturally sensitive rapport. Sorry. All right. Just like with the vulnerable populations, school nurses have to establish that kind of rapport and trust with the parents of the kids they have in their school. Right? We work with a lot of different cultures. And so school nurse needs to be culturally competent. What does culturally competent mean? They need to understand the values, beliefs, practices of different cultures, right? To be able to establish trust and give the parents a sense of comfort that you are aware of their cultural beliefs and will do everything you can to adhere to those cultural beliefs within the school. Right?
Right.
This next part is for the adolescent student who's begun dating, right? What one of the big risks of that, and this was in your readings, was the risk of violence. Adolescent dating increases the risk for youth violence. So if you talk to the student, right, you want to ask an open-ended question, not a judgmental question. A question like, describe your relationship, right? Open-ended, describe your relationship. Okay, not, does your mother approve of your boyfriend? Or how old is he? Or isn't that a big age difference? No, just let them describe it first. As they describe their relationship, you can probably ascertain information, right? Domestic violence can begin early in a teenage relationship, right? And we need to be in tune to that. Let students tell you about their relationship. Ask open-ended questions. Give them the opportunity to share the things that could be problematic or jealous partners. Okay, so the key is therapeutic communication, which we talked about above with vulnerable populations. Let them tell their story. You don't need to tell their story for them. Make sense?
Yeah.
Okay. Educating parents about maintaining their infant child's health and safety. What should they know? So this whole section goes about talking about how to do that. I want you to remember this statement because this is very important in this class overall. The greatest impact on a child's overall health status is the financial stability of the family. If the family does not have financial stability, there's a multitude of risks that are then in place. Nutrition, healthcare, education, daily living needs, clothes, food, right? Children that come from low income families have an increased risk of disease and injuries. We know that. We also will, as a community nurse, will want to educate new parents about safety guidelines for infants, including not to leave the infant. Here's some guidelines. You can read through this. Safety guidelines for infants. Do not leave the infant alone in the bathtub. Never leave an infant alone on an elevated surface. Cover electrical outlets. I mean, this is all common sense, right?
Yeah.
Regular checkups, immunizations. Kids should be physically active for 30 to 60 minutes a day. Talking with parents about COVID-19 hesitancy, right? We can't force them to get the vaccine, but we can certainly talk to them about provide them with mortality rates of vaccinated versus unvaccinated to better educate them. We can't condone them for not doing it, but we can certainly try and educate them about vaccinated versus unvaccinated. Okay? Caring for the immunocompromised child. Here's some examples of education with the family. Recommendations to prevent infections at home. Wash your hands before eating. When? Before eating, before, during, after handling, preparing food. Okay? Home safety. All right? Home safety evaluation. Gun safety is one of Healthy People 2030's goals to reduce firearm related deaths. Okay? So when you first go in and do a home visit, the very first question you ask is, do you have any weapons? If the answer is no, fine, move on. If it's yes, we need to be able to say right here, when evaluating the client's home for safety that has a firearm, the priority for the nurse is to find out where it's stored. You want to know where it's stored. That's the first thing you have to establish if they say they have firearms before you can continue on with your visit. Firearms should be stored unloaded, locked, and ammunition should be in a different locked area. Really important. Okay? And then your child, there are questions on this exam about every one of these childhood ailments. Okay, all of them. So there's about 6 to 8 bullets under each one. Okay? In your notes that I provided on this particular week, there's probably double the bullets. I've shortened them up to be the most important bullets. Okay, so this section, please go from these notes, not your class notes that I gave you. Okay, there's a couple of questions about each one. Alrighty, so we have asthma, eczema, and you should already be familiar with all these, right? From Med Surg, from Peds, right? So we have asthma, eczema, diabetes, conjunctivitis, scabies, ADHD, lice. Okay, so there's quite a bit of them. Okay, so study those. Okay, rural population. There are several questions on this exam about rural population and what we need to know about rural populations. Okay, so please study these bullets. We know that they're much less focused on health promotion, right? Remember we said that they don't have access to a lot of specialists, right? How do we motivate them? That's important. They don't really have a lot of motivation. We have to understand how to motivate them. And here's 4 examples how to motivate them. You will get asked about this. How do we motivate a rural community? Number 1, how do they feel about their health problem? Number 2, do they think the problem's serious? Whether they think the action on their part will make a difference, like going to get a blood pressure check. Whether they think they can manage the barriers. Let's say they don't have transportation, or they don't have, I don't know, they need an oncologist and they have to travel to the cities for that. Okay, these four things play a role in understanding motivation or helping to motivate the rural community who does not seek out healthcare, right? To understand it, we need to find out how they feel about all 4 of these things. And then we know that motivation will be most likely directly impacted positively by interventions that provide information from trusted sources. And that's what this is about. Okay, how do they feel about the health problem? Well, what do they know about the health problem? whether they think the problem is serious. Well, we have to educate them on, yes, it's serious. Okay. There appears to be a more persistent endemic level of depression among rural residents. Okay. What factors relate to depression? High rates of poverty, economic difficulties, geographic locations, insufficient number of mental health professionals, and so on. And then this is important. The characteristics of rural life include such things as, okay, and you could read through that.
Open space.
What characterizes rural rural life? Greater distances between residences. Maybe they have a lot of cyclic seasonal workers. Okay. Lack of anonymity. Everybody knows everything about everybody. Lots of similarities with the migrant workers, but there are a few differences, right? For a lot of migrant workers, language and cultural barriers are huge. Okay. They're seasonal, so they're moving around. They may have family with them. Because if a migrant farm worker may be employed in agriculture, this is important to know. Talked about this in class. Because the migrant farm worker is employed in agriculture, the most probable cause, their highest risk is pesticide exposure. And you need to know if a client presented to your clinic, what are the signs and symptoms of a pesticide exposure? And I highlighted this in our notes in this past week's lecture. How do you identify it? Exposure includes mild symptoms, headache, fatigue, dizziness, perspiration, loss of appetite, eye irritation, throat irritation. That's your minor symptoms. What are your severe symptoms? Fever, intense thirst, vomiting, muscle twitches, convulsions, okay? So you need to know, because if you're in a clinic in the migrant community, since their biggest risk is pesticide exposure, you need to be familiar with acute exposure and then severe poisoning, okay? And then read the rest of these 2 paragraphs about migrants. Okay. And then you can read this about healthy people. You are going to get asked about healthy people 2030. Okay. One of the healthy people 2030 goals is to reduce firearm related deaths. This is kind of a copy and paste from earlier. Okay. But this particular healthy people section talks about gun violence. So please reread that. Okay. And then homeless population, a little bit more information about homeless population. So read that. Then you have to know about the World Health Organization, the WHO. You need to know what their functions are. Okay, so according to World Health Organization, which is consistent with Healthy People 2030, describes 3 overall determinants of health. Please know what these 3 are. Okay, social and economic environment. That's the first one. Physical environment. That's the second one. And then the person's individual characteristics and behavior. All right. Mm-hmm. But please read the rest of that. Okay. But most importantly is the 3 overall determinants of health with the World Health Organization: social and economic, physical, and whatever the person's individual characteristics and behaviors are. Okay. Okay, so does that give you an idea how to attack your study guide?
Yeah.
Yes,
Brandy,
yes,
Tyen,
Yes, yes.
Candy?
I have a question.
Yeah, I
Um,
can
when
barely
you,
hear you, so speak up.
sorry, when you were talking about the math,
Yep.
where can I find that at again? Cause,
Your professor in an announcement sent you a math resource, and the title is probably Math Resources. And it's a
Okay.
link to Professor Bogart's YouTube. And Professor Bogart does a math tutorial.
okay, I can
It-
find it in there.
Yep, it's in your announcement. And in that announcement, there's some handouts that she goes along with during her training. It's very basic training, but it's very helpful. How to set up simple equations, how to do conversions. Okay.
Okay.
So if you
Thank you.
struggle in math, I would highly suggest you review Professor Bogart's tutorial. It's really
Okay.
basic and it's really helpful.
Thank
She's
you.
one of the peds. You may have her. She's one of the
I
peds
do.
instructors.
Mm.
Anyway, I've got tremendously positive feedback from students from the last term about reviewing that. Okay.
Thank you.
Okay. Does that help you guys?
Sure did.
Yes.
Okay. Again, start with the study guide and go from there. Let's say you don't understand vulnerable populations. Read what's on the study guide and then go back to the section of the reading, and it's all on the first page of the study guide. You don't have to go back to your syllabus. I've outlined it for you in the study guide. So for example, hang on. Let's say you've gone through your study guide and you're having trouble understanding what asthma is. You read the 6 bullets and I'm not really sure I understand that. Go back to your reading, read those pages to get a better understanding. Okay, if you're having if you're having a problem with that very first page, what's community-based versus community-oriented nursing, it's in your Canvas readings. If you're having a problem understanding Healthy People 2030 and its overall goals, there's your reading. Okay. If you want to read more about your migrant farm worker or rural population, here's your readings in your Canvas module under week 3. Okay, so every topic on your study guide is in either week 1, 2, or 3 readings. But I think there's enough information. I think there's enough information in the study guide for it to be your primary starting point. And then you know where to go to find additional information, right? Back to your lectures, back to your readings, back to your 2 weeks of discussion questions, back to your notes, your weekly notes that you've been given for 3 weeks. But don't overdo it. Okay? Don't overdo it. If you have a good understanding of the study guide, you will do absolutely fine on your exam. Okay? Questions? You guys good?
yes, ma'am.
Okay. And then we always offer too that as long as you do your due diligence and do your studying. So for example, if by next week you don't have an understanding of some of the things on the study guide, you've gone back to your readings, you've gone back to all the other resources, you're still not grasping this particular topic or concept, reach out to your professor and set up a tutoring, set up a one-on-one tutoring to go over the few things that you don't understand. Okay.
When do we get our grades again?
It won't be till that Saturday. So let's see, when do you take your exam? Next week? So you'll be taking it next week.
I understand.
Whoops. So we'll be meeting on Saturday, May 6th to do our exam review, because we still have classes on Friday. We can't do anything until everybody's taking the exam. So we typically meet on that Saturday morning, go through the exam, make any adjustments we need to make, and grades are usually posted by lunchtime on Saturday. Yeah, if you're in a Monday class, then yeah, you're gonna have to wait all week. So I'm sorry, that's the way it is. If you're in a Friday class, not too bad. The next day you'll have your grades. Okay? And of course, as you know, from previous classes, we cannot give out any information, not even, did I pass, did I fail? Can't do it. Okay, so I would appreciate if you would just respect that. Okay? And again, you study, you do your job studying, you do your part, and you should be fine. Okay? Nobody has their camera on, so I'm looking at a bunch of names. That's okay. Okie dokie, so that's all I have. Okay, so I've given you everything that you need to know. I will, this is recorded. And so I will be posting this recording in my announcements for my sections. And Professor Kershaw and Professor Ford will also have this recording, and it will be posted in your announcements as well.
Thank you.
Okay? All righty. Thank
Right,
you.
thank you.
Thanks
you.
for coming. Thank you. Thank you.
Bye.
Bye.